As we look ahead to 2025, understanding the symptoms of bird flu is crucial for healthcare professionals. The H5N1 strain, for instance, often presents with high fever, cough, and sore throat, mimicking common respiratory infections. However, watch for severe symptoms like difficulty breathing, chest pain, and rapid deterioration, which can indicate a more serious progression. Gastrointestinal symptoms, such as diarrhea and abdominal pain, are also noteworthy. In some cases, neurological symptoms like confusion or seizures may arise, particularly in severe infections. Early recognition and isolation of suspected cases are vital to prevent outbreaks. Staying informed and vigilant will be key in managing potential bird flu cases effectively.